Those of you who have been following me for a longer period of time know that 3 years ago I was diagnosed with the rather rare kind of cancer, Leiomayosarcoma. And since then I've been undergoing 2 open stomach surgeries. My last stomach surgery was this year on the 1st of August. And 2 tumors, like one 10 centimeters and the other one 12 centimeters, whose location was between stomach and intestines, were taken out. It was not inside the intestines, the tumors, but they were already that big that they were wrapping around the intestines and the nearby organs. So this was taken out, and I had my during this operation, during this surgery, I had my right colon removed, parts of the intestines, and something from the stomach wall. The stomach muscle was cut on the right side, so they put in, as we say in Hebrew, 2 reshatot, 2 meshes, in order to support the non-existing stomach muscle on the right side, because it doesn't, once it's cut so it doesn't grow back. But I have to say that I'm fine. I don't feel a difference when I go to the toilet, for instance. Everything is fine now. So, as you may know about sarcoma or leiomyosarcoma, it always comes by surprise. You know, you never know when another tumor is showing up and where. It can be anywhere, almost anywhere on the body. And so far, I've been going through this for the past 3 years. So with me, it's either in the stomach area, like between intestines and stomach, or it's in my right lung. No, left lung, sorry, left lung. So I had this taken out, as I said, the 2 tumors in August. And my last CT in September showed that everything is basically fine. Of course, it takes a longer period of time until, you know, after stomach surgery, after heavy-duty stomach surgery, so that the organs are being placed in the right position again. So they need a long time to recover. And it showed on my CT that I had just undergone surgery, and there was like a kind of, everything was pretty messed up. But it was okay. But it also showed that I have a nodule in my left lung. And this didn't come by surprise, because the CT in June, a few months before, already showed this. But by September it had grown. So now it's, in September it was like 1.5 centimeters, and it's sitting on the left lung, somewhere on top of the left lung, like on the upper part, not on the lower part. So my oncologist asked me if I want surgery, like a laparoscopy, to take this out, or if I prefer radiation. And I preferred radiation because I just had undergone surgery and I was really fed up with medical torture. And because of the chemotherapies, of the different chemotherapies, I also don't have veins. And you know, when you go into surgery, even if it's only a laparoscopy, let's say, they need to find veins to put in the IVs. And this is, for me, it was already in August, it was a disaster. I have a port, but you know, it was still a disaster because they had to find veins. And I underwent real torture to find veins. So I didn't want to go through this again, and I preferred radiation. I'm a patient at the oncology here in Shaarei Tzedek Medical Center in Jerusalem, and for radiation I had to go to Hadassah in Keren Hospital, to the competitor, so to speak, because Shaarei Tzedek does not offer this kind of specific SBRT or something, radiation, so I had to go to Hadassah. And I can only recommend the radiation at Hadassah. The department It was very nice, staff very nice, very professional. I can really recommend this. And so I had 3 radiation treatments, right, one after the other. And now I'm on a kind of break, cancer break, so to speak, if you may say so. Once you undergo radiation, it takes some time, it takes some weeks, a month, 2 months, I don't know, for a result to show up. It doesn't go like right away. Today you have radiation, and next week or tomorrow, by tomorrow you already know the result, if it helped or not. You have to wait at least a couple of weeks, a month, maybe 2 months, whatever. So I'm in a waiting position at the moment. Also, my oncologist from Share Tzedek is abroad, so I'm going to see him at the beginning of February when he's back, and we agreed that I'm having my next CT next month in January, unless I'm suffering from severe pain wherever in the body, so that another or a new tumor may grow. So then I can have the CT earlier, but otherwise I'm going to have it next month. I'm going to have it next month because, a CT means, another IV. And I'm not looking forward to this because the nurse has to find a vein. And this is another torture disaster. And at the moment, I'm not really suffering from pain regarding the cancer. Of course, I'm still in stomach pain sometimes because the organs are still, they have to recover from surgery. And I also got the 2 meshes inside, the 2 reshatot. So it's not easy, so the whole body has to adjust again and get back to normal. And everything could basically be fine. So I'm on this break, on the one hand, the break is very good because I don't have to go to the hospital, and I don't see torture instruments, and I don't have to undergo any treatments. So I can kind of relax. But on the other hand, with Leiomayosarcoma, you don't know what's going on. Something new could be growing already and I don't feel it. And it has been with me, it has been the case that always when I was on a short break, something new grew. And this is like the fear, that because I'm not on a real treatment at the moment, something could pop up. This is a fear, but I don't have too much time to think about it because I'm in bladder pain. I'm in severe bladder pain many times. And the bladder pain first showed up after my very first chemotherapy 2.5 years ago, after the second treatment. I had 2 treatments, like gemzar-taxotere, gemzar-docetaxel, you can also say. And after the second time, from one day to the next, the bladder pain came. And I didn't know what was going on. First of all, I had to go to the toilet all the time, which is like a pain. If you have to go every 15, 20 minutes, you go to the toilet to pee, it's a real pain because you can't go anywhere, you always have to find a toilet. So this was, okay, you can get used to that. And, but then the real bladder pain started, and I don't even know how to describe it, When you are in bladder pain, it's hard to walk, it's hard to sit down. It's hard to sit down, when I sit down, when I'm in bladder pain, and I have to sit down, it doesn't matter where I sit, I have to sit on the right first, and then move over to the left and find my position, and I can't even tell you what kind of a pain this is. It's like you want to jump up the roof. It's such a tremendous pain, it really limits my life. I could be happy that, as I said, I could not enjoy, because I'm still recovering from this surgery. But, you know, I could have a more or less a little normal life if I didn't have this bladder pain. It's not that I have it all the time. It's not 24 hours. Sometimes it's not every day. For the past months, it has been every day. Sometimes it goes away for a few months, for 2 months, 3 months, and then it shows up again. And as I said, it started 2.5 years ago, after the second chemotherapy treatment. And I went in the hospital, I went to my urologist, I went to my family doctor. My family doctor is also a gastro expert. And I talked to my oncologist. I talked to so many people. I talked to nurses, to everybody. And I was put on antibiotics twice. Didn't help. I took cranberry pills. Didn't help. I had a cystoscopy at the urology at Shari Tzedek. I do not recommend this. It doesn't hurt, but it's not very, it's not very nice. The result was my bladder is swollen and red. I saw it on the screen, on the computer screen next to me, and it looked like Mars. So the urologist said, your bladder is swollen and red. Okay, come back next month for another cystoscopy. But I didn't get any pills or painkillers or anything, I took the regular painkillers, but it didn't really help. Eventually my family doctor gave me 2 kinds of very good pills, and it helped. And then it was gone, and then it came back, and no one was able to find out what really caused this tremendous bladder problem. Of course, my first surgery, when I had my first surgery, I had a huge stomach tumor. And this tumor was 6 kilos. And it was pushing on my kidneys and on my bladder. So during surgery, the connection, there's like a kind of, pipe or something, the connection between the left kidney and the bladder was cut. It was also destroyed by the weight of the tumor. So it was cut, and I got a stent. The stent was inside for 2 months, and then it was pulled out. But I did not have any bladder pain or any problems. Not when the stent was inside, and not after the stent was taken out. Half a year later, when I started my first chemotherapy, as I said, after the second treatment, it came out of the blue. There was no warning. It was just like there, from one day to the next. And since then, I've been suffering from this tremendous bladder pain. And of course, my doctor said, okay, it could be from the steroids you get during chemotherapy. Or it could have been the Gemza, or it could have been the Taxotere. It could have been like the chemotherapy. But no one was able to find out what really caused it. And the problem is, it doesn't go away. I've been on Gemtex, on Gemza Taxotere, for 1 year and 3 months. I had, 36 or 37 treatments. And I haven't been on for over 1 year now. So the pain comes and goes. Sometimes I have a few months break, and also after surgery, in summer, I had a few months break, and a month ago it came back. And the medication my family doctor gave me doesn't help anymore. It's worn out. So I went to see him a week ago, and he gave me new pills. Like one kind to clean out my kidneys, the other kind to calm down my bladder, and I got a gel. And so far, it's been helping. The pain is still there, and sometimes it's still really bad. But generally speaking, it's less. But my problem is, I'm off cancer treatment at the moment. I don't know what's coming after my CT next month. I don't know what's gonna come. And I just can't enjoy life. No? I can't just go back to having a normal day because I would like to go out, to go for a walk. I still have to sit down on benches and everything, but I got used to that because many times I'm weak. It depends from day to day, but at least I could go out or maybe do something. But you know what? Even if I go shopping or something, I don't know, I'm in the middle of the supermarket and the pain starts. I can't make any plans because of this tremendous pain. So before I leave the house, I usually take my medication. I take the medication anyway. But another thing is also that I still have to go to the toilet all the time. I go out and after 20 minutes, half an hour, I need to look for a toilet. Also, when I was shopping at the supermarket last Thursday, I had to ask the staff where the washroom is. so it's it's really, really bothering. And it's also bothering friends when I have to go to the first thing, I have to look for the restroom. But it's even bothering me much more because I have to do this. I'm not free. I'm limited. I'm toilet limited. It's really bothering. Okay, I can get used to the toilet. Fine. But, having this pain is a real pain. And it's such a tremendous pain that I can't even describe it. I don't know what to do anymore. No one really refers to this. Everybody is like the hospital and everybody is fighting the cancer so that we get it under control or whatever you may name it. But no one is really too much referring to the bladder problem. And I have to tell you, these days, I don't care about the cancer. I don't. Because I'm too busy with this bladder pain. I don't even care about the cancer anymore. I don't care. Because, I'm busy with this freaking pain that just doesn't go away. And I don't know what to do. I can sit, I can lay, I can stand. It doesn't matter what I do. It just doesn't go away. So I don't know if any one of you has the same problem during chemotherapy or after chemotherapy. My chemo nurse at the hospital, she told me that quite a few people have this problem. And I don't know, maybe you can let me know how you solve this bladder problem or what you are doing against it. I've taken quite a few different kinds of pills. I went to so many, my oncologist calls it culture, like these culture tests, like where you pee into this box and they check. The last check I had a week ago, it doesn't show any bacteria, but I have too many red blood cells in the urine. And I just don't know what to do anymore. And it's really, really limiting my life, as if I don't have enough to do with cancer. Now I also have this side effect from wherever it came, and I have to deal with that. And this is bothering me at the moment. This is bothering me much more than any kind of cancer. And sometimes I'm like in stomach pain, which is compared to the bladder pain, nothing. Sometimes I'm in lung pain. I don't have problems breathing, but it's like a sting all the time, but only going on for a few minutes. I can deal with that. But as I said, the worst at the moment is the bladder pain. And I just don't know how to get rid of this problem. So maybe any one of you has an idea. And in the meantime, I have to deal with that. And in another month from now, I'm having the next CT, and then we will see. We will see if the 3 radiation treatments actually did something, if they caused anything. Maybe not. Maybe I have to undergo another 2 treatments, or I have to be in hospital and have the lung laparoscopy. Could be. It can be that until then a new tumor is growing. So, I'm always in this position, and it's not only me, it's everybody suffering from leiomyosarcoma. You're always in a position you don't know what's going on. You live basically from CT to CT. Every 3 months I have another CT. Sometimes every 2nd month, but usually every 3 months I have a CT. And you never know, if something grew, if something is suddenly pops up. If not, usually I have something popping up. It's been going on for 3 years now. I've always something popping up, either in the stomach or in the lung. So, but this doesn't, it's funny, but you kind of get used to the situation. It actually happened to me that I got used to the situation. It doesn't really bother me too much. I'm not worried. I'm very, very positive. I have a normal life. I can't work because every day for me is different. Because after 3 chemotherapies and the surgery, it's very hard to find back to your normal life. But it's very important to have your daily routine, to get up at a certain time and to do certain things. I have a friend, she comes all the time, and she helps like cleaning and shopping, but I try to do this also myself, because I want my old life back. I know that this is very hard because, I need many breaks. It goes slowly. I need to take breaks. I have to sit down after a few minutes. And when I sit down, there's a danger that I fall asleep. And then I want to do something, like cleaning the windows. I'm saying, in another 10 minutes, I'm going to clean the windows. What happens? Boom! The bladder pain suddenly comes. And there's no window cleaning because I can't move because of this bladder pain. So, I don't want to, take out the little violin and whine and, complain. I'm not complaining. There are people who are much worse off than me. I'm actually, compared to other people, I'm not okay, but, I'm not as bad as other people. So I'm not complaining. Maybe I am complaining, but I'm not complaining. But, what I wish is that I could just have my normal old life back and just live a normal life. I'm trying to do this every day in a way. Of course, I have to see if I'm in bladder pain or not. But when I'm not, so I try to just have a normal life, more or less, to do things like I prepare food, I go shopping, or I go out, whatever. But I think that this is very important to have this. You shouldn't just sit at home and be depressed, even if your situation is worse than mine. I think it's very important to not to sit and think about cancer, but to, to deal, I don't know, to talk to people, to go out, to read a book, to watch a movie. I don't know what, but you can't just sit and think. And I'm not this type. I hardly think about the cancer. The only thing really bothering me, besides the bladder pain, is like this, these hospital treatments with needles and knives and, all these kinds of torture items. And every time they have new ideas what they could do to you. You know, this is, I can't see blood and I can't see anything. And this is bothering me much more than, you know, the cancer itself. But it's a situation you have to live with. And not the type saying, oh, why did it happen to me? And, oh, I'm not. You know, this is a situation in life and you have to deal with it. But I have to say, I'm really sick of this bladder pain and I don't want to deal with this anymore. But I don't know how to get rid of it. So, as I said, maybe someone, one of you maybe has an idea or had the same problem and got rid of it. Please let me know what you did. And yeah, now I have to go to the loo. So thank you very much for listening to my complaints, whining, and the little violin. And I wish you a great day without any pain, and stay healthy.